it's sort of humbling as a researcher when you get to work with the people that are affected by the different conditions that we do research on. PPI is a hugely important part of what we do in RCSI. In fact, it's so important that we've now firmly embedded in our new institutional strategy. But what I really thought was fantastic today was to hear all the perspectives from the different patient contributors specifically.
Today was a great example, I think, of unity and people really being brought together in one space to talk about the current state of public and patient involvement, as well as future directions, where things are headed in the next steps. I saw a lot of unity in the room, and people were really, I think, showcasing that collaboration and the networks that they have between people with lived experience and researchers and scientists themselves. It was also really good to have stakeholders in the room coming from regulatory bodies and funding bodies as well. That's always a unique experience when you get everybody in one space at the same time. And I think it was fabulous that RCSI PPI was able to do that today.
Events like this are really important, that there has been a view that doctors fixed people, whereas in actual fact, healthcare is a cooperation between patients and the healthcare people. And what gives us long life is not high-tech medicine, it's how we interact and collaborate together.
So today was really great to just hear from all different PPI contributors and researchers on what they're doing, and it's great to kind of get feedback from other people on what they've learned, and hopefully kind of grow the area of PPI within RCSI and beyond.
I spoke a bit earlier about some of the PPI work we're doing here at RCSI, and my work is on patient and public involvement for preclinical spinal cord research. And what we're trying to do is look at PPI in a laboratory-based setting. So a lot of PPI work is done on clinical research, with human populations, and we want to figure out how we can do that best in a laboratory, so research on cells or materials. So we work with a PPI advisory panel with researchers, clinicians, and seriously injured rugby players from the IRFU Charitable Trust to figure out the best ways of doing PPI in this setting. Today we heard from loads of experts, patients, members of the public, about all the great PPI work going on here, and it was great to be part of the work today.
It was also fantastic to see the representatives from the different charities and from the funding agencies here today, because obviously we can't do PPI unless we receive funding to grow our programs and develop it. So a really wonderful morning, and augurs really well for the PPI Ignite network in the future.